glass, of seeing what's there, a colorful reflective glow, right? Like I think of those aha moments. So a lot of reflective capacity, like a lot of treatment has like those aha moments where it's just like a reflective glow. And so I really enjoy that. And a lot of the population that I work with, like I said, is a lot of pregnant women who are in recovery. And so that's kind of where I'm going to focus today with utilizing a reflective capacity. But when working with pregnant people who are in recovery, it's really nice because they seem really highly motivated. A lot of the times they're younger, so their disease is less progressed. They have a support system, and part of the reflective capacity is starting to identify how much of that support system is healthy for them and how they have to kind of maybe sometimes cut off some unhealthy family members or supports and move to other ones. But this can be a very overwhelming stage in their life for pregnant people, especially pregnant people in recovery. But people who are pregnant in recovery, they seem more hopeful, right? So their focus is definitely not only on them, but the baby that they're carrying. And sometimes that drives a higher motivation. When we're reflecting and working with the pregnant and postpartum population, we're really looking for that optimal bonding, right? And in that dyadic work. So really looking to increase that to help stability, health, and well-being, not only for the caregiver, but for the child and for the family as a whole. And so we're really reflecting to help the family as a whole. That reflective capacity is really just about moving to become more empathetic and understanding their child's process. And they understand their child's process through the relationships and their development. And so it's really just building that empathetic understanding. A lot of the times when we're working with pregnant people, and pregnant people in recovery too, we deal with a lot of trauma in our line of work, and many of the times there's that kind of intergenerational trauma that many of you have heard me talk about over and over again. But that intergenerational trauma that just kind of comes forward when you're about to have a baby and thinking about what kind of parenting you've had and what kind of parent you're going to be. And many of the times, a lot of that trauma can resurface, and it can create this barrier from being empathetic to what the child's perspective may be. Protective factors for the dyad are being more sensitive, safe, and consistent. And this really promotes that resiliency. So when we're looking at, make sure I shut my door. So when we're looking at building those relationships, you're looking to open up that sensitivity, making sure that the parent feels safe so that they can convey that to the child and their safety. And how a child feels safe is that a parent meets their needs, right? And so we're really building that for resiliency and consistency, knowing what's coming next. That safety, security, and predictability is really what's needed to build resiliency and to promote healthy relationships. So being sensitive is like a parallel process. So when we're building this reflective capacity, we're working with parents to be sensitive, but as providers, we want to be sensitive too. And so that's a real big piece of reflective capacity, is this whole parallel process. And it's in everything. I mean, it's in every treatment approach, really. But being sensitive is as a provider, being welcoming, inclusive, non-biased, and engaging. And the reality is we're all biased. We all have biases, right? And we all bring biases into relationships that we have, whether it's with patients, with one another. We have these biases, but it's how we allow these biases to impact is what's important. And so when you're a provider, understanding your biases, the biases you're bringing into a family and how they're coming across is what's really important. So when we're saying being non-biased, that's really inaccurate, right? Because we all have biases. So it's just about being open and willing to reflect on your bias and to being able to manage it. It's important to manage your biases, but you're never going to manage them if you say, oh, because I hear providers say, oh, I'm non-biased. And I'm like, well, what does that mean? And when they can't tell me what that means, I have a really hard time with that, because then you're not reflecting on it, right? Because the reality is you do bring biases. And so the reflective capacity really does explore that too. That's a huge piece. this morning I was just teaching Brazelton touch points, and part of Brazelton touch points is about exploring those biases and those perspectives. And so, it's really important in a reflective capacity to explore that. We can help build treatment. We can help provide resources. Again, that sensitivity is what's really important. So the slide before, making sure that we're welcoming, that we're building that relationship. We're not going to get anywhere with a patient and with exploring reflective capacity. Well, really, any type of treatment if we don't build a relationship, right? So a lot of the times when I have supervisees that are like, oh, I can't move forward in treatment, like they're not open to any resources. I can't even talk to them about anything, right? So I come back to this very last one. Is there trust? Is there trust, and do you have a relationship? Because if you don't, you're not going to get these other 3 items. You're not going to move anywhere in treatment. You're not going to be able to provide any resources or any education. A lot of the times when we are working with patients, they'll say, oh, I have this research study and I think of a patient that might be beneficial of that. And they're like, well, do you think they're going to be open to it? And I said, you know what, if we have a relationship and I think it's important to them, I'm sure they'll be open to it, right? And a lot of the times you can move patients forward with just having that relationship. And that's the reflective capacity. That's really what we're trying to get them to do with their little ones too. So infants and toddlers and young children, when you're working with pregnant people, the goal is to kind of build that relationship, come alongside them so that when it comes to their little ones, they're doing the same thing. They're providing that safety, security, predictability, and they're just there for them. And they're just able to support them so that they can grow and develop. And that's a really important piece. But it's also a really hard piece. We know that women, especially women with substance use disorder, have tons of trauma. About 80% of women who have a substance use disorder have experienced complex trauma. And this can be at many different levels, right? Caregiver betrayal, a lot of the times the caregivers that were not really supportive for them or there for them from the beginning are now taking care of their children. So that's almost like a betrayal in some senses. And many of them feel that. Many come from homes of abuse and neglect or situations of abuse and neglect. Loss is huge, whether it's losing somebody or losing their children to CPS, losing their children to other people, having to create boundaries or a physical loss, right? And exposure to violence. This is something that's really significant when we're working in a reflective capacity, because exposure to violence completely rewires and restructures the brain. And so you're doing a lot of work there. And there's a lot to kind of sort through. But it's important, especially for pregnant people, because trauma is linked to emotional attunement. And if we can't help individuals work through that and reflect on what's coming up for them, then many of the times it's hard for them to remain emotionally available to their children. So that's what our goal is we're really helping them reflect upon their own experiences and what's going on with them so that they can remain emotionally attuned with their children. We work on parental sensitivity. So noticing those signals. And when we're talking about infants, noticing the social referencing, right? Looking at the parent to see how they should respond or they should act. Notice their cries and when they're crying and what they're needing and if they're just needing attention or if they need fed, right? So noticing these signals and interpreting them appropriately. A lot of the times, believe it or not, a lot of the times my moms with a substance use disorder, depending on what their own trauma is, a lot of the times their interpretation of the signals are just amazing. Like many of the times we think that this is a simple piece, but for many people who are experiencing trauma and have a difficult time attuning emotionally, their mind goes all over the place. And they can have some real thought distortions over interpreting baby signals. I was listening to another provider. This was a couple of weeks ago in one of our trainings. Another provider was sharing about how the baby would when the baby started to talk, they would say like who, ha, and the mom interpreted the baby calling her a hoe, and the father, the so it would have been the baby's grandfather, and the mom's father really had degraded her and it was verbally abusive about her getting pregnant and being a slut and being a hoe. And so she interpreted her baby calling her a hoe, and so she had a really rejecting response every time the baby started verbalizing. And just think of the different perceptions, right? Think of the mother's perception of, oh my gosh, my baby is now degrading. My baby, the one person that I thought would love me no matter what, is calling me a hoe or thinks I'm a hoe, right? And then you have the baby's perspective who's like, yeah, I'm trying to talk here. I'm ooh, oh, and then they're looking to their mom for a response. And then this is the mom's response, right? So the mom kind of shuts off. And so then we're missing some of that attunement. And so there's a big mismatch there. And I've had moms who have, I had one mom who rarely picked their baby up. The signals were there, right? The crying, the fussing, the high-pitched squeals. And she had a difficult time picking that baby up. And when she would pick that baby up, she was super nervous and very stiff, not very nurturing in her physical responses. And so the more we reflected, so the more we reflected, the more she was able to identify how physically abusive her mother was and how fearful she was that she was going to do that to her child. And so she rarely attended to her child. But just think of that, what children need, right? That safety, security, predictability. They're not feeling safe because the parent's not even responding to them. That consistency is gone. And so these are like some of those misinterpretations that can happen a lot of the times. And that sensitivity is linked to attachment, right? So you can just think of how that could impact attachment and responding to cues, right? Responding to those signals. So that example that I just gave you, the mom's not really responding to those signals. So that infant's perspective is that she's not really able to get her needs met, right? She's not effectively communicating. And so unable to kind of move towards that next developmental stage. So we're building, when we're working on a reflective capacity, we're building some of that sensitive parenting so that we're building attachment, adequate perceptions. And we're not telling people like, your perception's a little off. I think you're distorted a little there in your thinking, right? We're not telling people that. We're coming alongside them and we're gaining through this natural curiosity. Tell me what it's like for, your baby to call you a hoe. Like, tell me what it's like to feel like you're going to hurt your child, right? And so really gaining that and exploring what their needs might be and really reflecting upon that. But also teaching how to interpret some of these pieces. And so teaching them to promptly respond, what they need to do that, what adequate responses are. And so not really telling them, but coming alongside of them, being curious to what their thoughts and feelings are, and then building them up from there. We know that there are a lot of risk factors for families in recovery, and so there's a lot to kind of sort through on top of this possible complex trauma in building a reflective piece. So with families in recovery, we know there's tons of, we're talking about this generational piece. Sometimes there's some impaired attachment themselves. So they're having a very difficult time regulating their own emotions, yet to be emotionally available for their child. So that can be super difficult on top of any other type of economic hardships. A lot of the times we have individuals with legal problems, a lot of, violence, problems with getting their license back, overcoming some of those barriers, having appropriate supports, right? So we know there are already a lot of risk factors on top of all of this. So we want to make sure that we're providing compassionate care, and we want this to be a parallel process again. So, providing compassionate care to the caregiver, especially after the baby comes. A lot of the times, we're working on different pieces like newborn care, breastfeeding, and bonding, right? But not really always giving education on some of the other pieces like sleep, mood changes, how normal this is, right? And a lot of the times we seem to we seem to miss the part where the focus shifts to the baby. And so a lot of the times you're working with a pregnant person, and then once the baby's born, that focus shifts there, right? Like to caring for the baby, taking care of the baby. We just talked about all the signals, right? But mom loses a whole lot of attention there. And so making sure we're still providing a lot of compassionate care. And moms struggle with that because they're struggling with a lot of internal pieces. And so shifting and having their hormones shift at that time too is important, and important to acknowledge. But then come other stressors, right? A lot of moms lose their health insurance at that point then. And so then other financial stressors come on top of that. I have moms that want to be great moms. I've never met a parent, and I'll say this, I've never met a parent that does not want to be a good parent. Like I've never met a parent that says, you know what, I'm just hoping that I epically fail my child and they're a disaster in life. Never in my life have I met a parent with those goals. But they want to be great parents, and they're ashamed a lot of the times when they can't meet some of those needs. And I think social media makes it very hard. A lot of the times moms feel like they have to keep up with social media and taking their kids places. And I do a lot of that with my groups. I do a pregnant and postpartum moms group that struggle with substance use disorder. And a lot of the times the moms talk about, I see all these pictures of people going places and going on their vacations and doing this, and I just want my kids, I feel like my kids are missing out. I feel like I'm not getting them, right? And so I think there's a lot of pressure on moms to be normal, to like take their kids to, shopping for the first day of school, or we always talk about, around the holidays, the pictures, posts of all of the Christmas presents under the tree. And we talk about what the real importance is there, right? And so I think there's a lot of pressure on moms to have these culturally normal pieces. I don't really know how normal they are though, but moms knowing what their kids need or knowing what their kids want. And here's the reality. And I tell parents this all the time. The research shows, so along with kids throughout their lives, especially in infancy and pregnancy, we all talk about that bonding and that attachment and connecting with your babies, right? Well, here's the reality. So let me just put it out there. How many of you can tell me like what the percentage of a mom and a baby should match, or a caregiver and baby should match? How often would you say percentage? Should they be attuned with one another? How often does that happen? Anybody want to take a wild guess? I can't see my chat, so do I have anything in chat?
No, I was about to chat people. You can chat in, raise your
Come
hand.
on, everybody, take a wild guess. How much does a caregiver and an infant match each other in a tune? No wild guess.
Like 80%.
80%? That's a good guess. Any other guesses?
Like it. Do you win a prize? I'm just kidding. I don't know. 80. I think it's in the 80s as well. I would guess
think it's
like
in the 80s?
88.
So we definitely want them to match more than mismatch, right? 50%. So Mia says 50%. So the research shows that the amount of time a caregiver and infant match and attune with one another is 20% of the time, right? The rest is a mismatch. So think of these parents and these infants who are matching and then mismatching and then repairing with one another. That's the whole goal, is to match, mismatch, and repair. But the reality is the match is only happening 20%, and that's in healthy relationships. So imagine unhealthy relationships, these moms that feel this rejection because there's a mismatch. Then there's a likelihood of derailment. And so we want to avoid that derailment and teach moms and caregivers that you can repair, come in and repair, right? It's okay if the infant looked away, right? It's okay if they cried and they're distressed and you can't calm them down. Repair, try to calm down as much as you can, right? And take some time for yourself, because the reality is it's only 20%. And here's the other important factor, is that's a competency. We want infants to be distressed a little like that. We want them to be able to repair and to meet that caregiver again. That's an important piece. And so just kind of helping the parent value that little bit of disorganization that the infants might be having at that time is important too. Okay. If I can get my slides to move. Sensitive disciplining. So we kind of explore that in reflective capacity, because just being sensitive. So positive reinforcement is number one. We talk about time out and taking a time out for the parent and for the child, and having empathy for your child. Like, what might they be going through? I've talked about this, and here's the reality too, that match, mismatch, and repair happens at each developmental stage. And so kids a lot of the times will regress, and infants and toddlers, they regress before they move forward. And many of the times parents are like, well, we can't go back to this, we can't go all the way back to this. And we talk about just having empathy, like, what are they going through, right? Think about the child's perspective at this time and what they might be going through. And we build that reflective capacity to move forward, because many of the times, and especially with my families with substance use disorder, many of the times they so badly want their children to succeed because they feel so guilty and feel like they've impacted or they've delayed their development in some sense. And so we talk about ways to just kind of move forward together. Building a reflective capacity. This is linked to the cognitive development as well as building a complex relationship, right? It's linked to attachment, attunement. It's also linked to disappointing relationships. So like we talked about, that little bit of building a repair is important. It leaves a lot of opportunity for derailment, but many of the times coming alongside and helping parents to learn how to build that repair is really important. Many of the times in working with pregnant and postpartum people, you're working to build this reflective capacity where you're re-experiencing some of the emotions. Anytime you work with somebody who's been influenced by trauma or deals with complex trauma, then you're looking at re-experiencing emotions. So that can be very dangerous. But supporting them along that way and making sure that they have the coping skills to manage that. You're evaluating aspects and how they're identifying signals and how they're responding to signals and exploring that with them. Understanding provoked emotions that could be provoked by the child, right? And ways to remain emotionally available. Then you're moving towards healing. I really love this quote, practice staying connected to yourself even while taking care of another. And how hard that is. Like how many, I just think of, I went to my PCP yesterday, and my daughter, I think I've said this in here before, but she broke her knee about a year ago. And so we've had like, I can't tell you how many doctor's appointments for weeks, 2 or 3 every week, right? Like, so of course I didn't get my mammogram. I didn't get all the updated things I was supposed to get. And so I didn't take care of myself, right? While taking care of somebody else. I wasn't connected to myself. And I told my doctor that. I said, I need to reconnect with myself. I said, because I lost myself in taking care of my daughter. And how often parents do that, right? They lose themselves in taking care of somebody else, and how important that is. And, I talk with my pregnant people about who are struggling with substance use disorder, and how important it is to take care of themselves and to focus on themselves and managing their emotions while trying to take care of their kids. And that's really hard. A lot of the times when you're working with pregnant people and infants and toddlers, we talk about ways that you can build that reflective capacity, right? Serve and return is one of those ways. So when the baby kind of gives a signal and cue and the parent returns it, you're building that, you're exploring that. Like if they aren't able to return it, why aren't you able? Like, what's going on with you right now? Tell me what feelings are coming up for you. What are you thinking? And or when they have built it, right? When they do return, that's amazing. How did you do that? How did you know that they were going to get scared at that moment, right? And what an amazing opportunity to treat that parent as the expert. Like, you are the expert in your child, and that builds somebody. Reframing some of those thoughts, and you can just repeat or paraphrase back in a positive way of what somebody might be feeling, and it helps them really think about it differently. Building empathy, and we talk about these things, right? We talk about these things, we learn about these things all the time, but I want you to understand that when building a reflective capacity in this sense, it's so very important. Building empathy, limit setting can help with that consistency. Kids actually feel more safe and secure when there are limits, and they need limits. A lot of the times we have permissive parents that struggle, and then they struggle with, they're like, my kid got everything they possibly wanted. I don't know why they're acting like this. And many of the times it's because they got everything they wanted. And when we have parents that are struggling with shame and guilt, they have a hard time setting limits. And so we use a reflective capacity. The same thing with kids with a lot of the times with special needs or complex medical issues. Many of the times they give in because they feel bad and guilty in one area. And so we kind of reflect on that. Exploring their social emotional development and their physical development, right? So a lot of building a reflective capacity is just helping parents understand what's developmentally appropriate, right? And building the relationship alongside of that, which is really important in building that social emotional development. So I mentioned the Brazelton's training this morning, and this is T. Barry Brazelton's touch points and guiding principles. I love his touch points. If you guys don't know who he is, please look him up and even just Google, like, YouTube some of his videos. I'm a guru. I'm like one of those fans of his, right? Like, he's just like the guru to me. Like, I could watch him in amazement every time. He has an amazing touch with parents and children, and he will just sit there and guide parents along and make them feel so secure in what they're doing, right? And so he uses these guiding principles. And when I learned these guiding principles, I had to use like 2 at a time. He can be in session and use all of these at the same time because he's just so amazing. But I use like 2 at a time because I can't always remember every single one. But it really helps you focus and value the relationship and provide it in a reflective capacity, right? And it really helps to focus on that parent-child relationship. You know, when I do work with postpartum moms, and anytime I'm doing reflective capacity, actually anytime somebody brings a kid in, I really don't have, everybody's like, every time I have a student, they're like, well, how do you not like just want to pick them up and want to love them all over, right? Like, it's so, and I love loving on babies, like, and some of the cutest babies have come across my office, let me just tell you. But I will tell you this, I don't typically hold babies, and I won't typically pick them up. I don't typically interact with them. We just had a parent-child interaction therapy toddler group, and we had like a celebration, and I did pick up those babies because, the moms needed to pay attention. So I took advantage of that situation, but it was after they held them. Because here's the reason why I don't, is because a lot of the times these parents and caregivers are coming in for this mismatch issue, and it doesn't seem like they're able to repair as much. And many of the times they derail, and there's sometimes stress in the relationship. And what would it be like if I, as a provider, picked this baby up and was able to relieve that distress, right? That parent would then feel like a failure again. And I'm not really trying to promote that. So I really work through them providing help for the distress or situation. And trust me, I've had parents that said, I can't get them to stop crying. Here, you hold them, you try. I'm like, no, they look comfortable. And I point out observations of them in their arms. And I also don't provide any type of parenting for kids when they're in my office either, because that I can give ground rules. Sometimes if I have kids that kind of go all over the place, I'll give ground rules for my office, but I typically do not step in and parent, because it is really up to that parent to do that. And I'm not going to take control there, because if I do, it can cause problems within that dyad. And so I step back from that. Interventions with reflective capacity. So CPP, child parent psychotherapy, is a lot of what we talked about, a lot of reflective capacity. Circle of security is a great reflective capacity approach too. It utilizes some of those strategies. Emotional attunement and how to remain emotionally available for children. And so kind of how to open that up. Attachment biobehavioral catch-up. So this is about building that attachment in a reflective capacity way, and then kind of reading your children and catching up and having them catch up, and kind of that match, right? So it's teaching the repair and the match again. And then parent-child interaction therapy, we utilize toddler version that really focuses on that emotional attunement, being aware of your own emotions so that you can stay available for your child's emotions. So I'm going to play this video. Hopefully it works. Nope, maybe I will not. Nope, I'm not. Let me see if I can find it. Let me try, give me 1 second. Let me try to YouTube it. I think I might have showed it on here before. Oh, yeah, here it is. Okay, let me share again. Make sure I hit share sound. Okay, can you guys see the YouTube?
Yes, we can see it. Let me see if we'll hear it, Amanda.
You hear it?
Parents.
Can you hear it?
Yes.
Throughout history,
Thank
we've
you.
struggled to get it right. We hope we won't pass on our emotional issues to our kids, and we swear we won't make the same mistakes our parents did. We all have great intentions, but something seems to get in the way. Let's look at what that might be. At Circle of Security Parenting, we believe that being emotionally available to our children and their needs is the key to doing our best as parents. We call emotional availability being with. It means teaching emotional intelligence by being with our children in all their feelings, like sadness, joy, anger, curiosity, pain, frustration, excitement, and so on. Being with children helps them understand, trust, and move on from feelings. And knowing someone is with them in their feelings helps children feel less overwhelmed and more secure. Decades of research backs this up. For parents, some of this comes easily, but other times our children express emotions that make us uncomfortable, so we pull away or try to overrule their feelings, which leaves them on their own. We do this because our children's feelings can trigger strong emotions in us. We think of it like this: our history during childhood of how core people responded to our different emotions creates the background music for how we experience our children's feelings. Let's look at this example. This girl and her father have been enjoying time together in the park, but suddenly aware of the time, Dad says, "We need to go." When the girl hears this, she starts crying and gets increasingly angry. All at once, the dad's background music changes. The background music that is playing for the father right now, we call shark music. As it turns out, the dad's own mother was uncomfortable with loud displays of emotion, and she didn't know how to handle them. So throughout his childhood, she repeatedly told her son it was pathetic to cry, and she never ever asked him about his feelings of sadness or anger. His ability to deal with his daughter's emotion now is greatly affected by the experience with his mother then. Shark music, we're rarely aware it's playing, but it's our past experiences telling us to be afraid of or uncomfortable with a feeling or need that is actually safe. When our shark music limits our ability to respond to these feelings, our children learn to hide or feel ashamed of them. This is a problem because we're teaching our children to fear emotions that are actually both safe and essential in life. Most of us experience shark music with one emotion or another, and it's different for everyone. But whenever it is triggered, our ability to respond to our children's needs is limited. The good news is, by simply calling it by name and reflecting on what our children need in the moment, we can turn down our shark music. This is so important because if we can learn to manage our history of negative experiences and perceptions, we can respond to the truth of our child's current situation and be with them in it. Ultimately, this will help our children grow up with a better ability to understand and share more of the emotions they experience. There's no escaping it. Strong feelings are a challenge to manage as parents, but our children always benefit when we have an accurate response to what's happening, rather than reacting to the sharp music we're bringing into the relationship. Remember, there's no such thing as perfect parenting, and blame never helped anyone feel more secure. That includes blaming ourselves. But the more often we can identify our shark music, the better off our children will be.
Okay, I'm gonna stop sharing. So what did you all think?
Well, I just want to say thank you so much, Amanda. You always do a wonderful job and you're so warm and just make me feel like I understand what's going on. I don't have any kids, but I think I would handle that situation like the father at the end where I would just get frustrated and be like, we're going, but again, I think we've all experienced different. Hey, my parents were fine. I think they all give us a little bit of trauma somehow.
Absolutely. We all have, like the video said, we all have shark music, right? And unfortunately, the more trauma you've experienced, sometimes the more your shark music is undetected, and sometimes the more shark music you have too, to a lot of different things. And so that can be really difficult. Any other thoughts?
I loved that video. I'm just like thinking from like a curriculum perspective and like the kind of trainings that we do for our parents. I would love a link to that. So I don't know if that'll be in like the notes when you guys send out the presentation slides or whatever, but I love that. And I worked with parents before many years ago with little ones like you, Amanda, and just the building of the trust, like you were talking earlier in the presentation of like, the key to getting any work done or to getting the parents to really learn how to bond with their child really is in building that initial rapport as their provider, and so
Yeah.
I loved what you share, how you handle your sessions when they come in and like kind of backing off, because it's really their place to bond with the child and care for those immediate needs. The baby learns, that's the first person to care, for their needs. So wonderful presentation. Thank you so much.
Well, thank you. Yeah, absolutely. I will send this link, but if you Google shark music circle security, it'll come up too. But yeah, you're absolutely right. And I think that especially with this population, and I was just teaching another group this morning about some of this and in a different capacity. But one of the things we talked about that made me think as I'm talking here is, a lot of the times when I'm talking about the reflective capacity and coming alongside, like you can see how gentle in this video, like kind of just addressing your own shark music can reduce some of that, right? And so for a lot of the times for parents that we're working with, and we're all fixers, right? Like we're all in this field for a reason and we're fixers. But unfortunately, when you're working with new parents, it's not really beneficial to be a fixer at that time. And so many of the times they have a lot of people telling them what they need to do, how to do, and everybody has an opinion on parenting. And so many of the times for providers in a reflective capacity, you're just coming alongside with that curiosity and pointing out some of the small pieces, right? Wow, you got them to stop crying. Look how much they love you, right? Like just kind of cheerleading, but also really curious. Like, how did you get them to sit with you and play for so long, right? So you're building while you're pointing out exactly what it is you need them to start doing or continue to do. So imagine if I went in and I said, well, if you sat next to them while they played, they wouldn't get so upset about everything, right? Like if I guided a parent versus saying, wow, look how they're responding. They love you sitting next to them. How did you know to do that, right? Like it makes the parent feel like the expert and it's no longer this defense piece. And so it's a big difference, but it's sometimes hard. Like sometimes, you're running from one session to the next and you can't really get into that mind frame. And so when you're doing reflective work and a reflective capacity, sometimes you have to like mentally prepare yourself to go into that, because when you're coming, like I come from a structured therapy. If I come from a structured therapy where I am guiding more, then it's hard. It's hard for me to get in that reflective mindset. So I have to do that myself before I start guiding families. Any other thoughts? Any questions?
You can unmute. We have time. Do you ever see, jealousy between parents and the child?
Yeah, absolutely. And not only just the parents, but other caregivers, right? So a lot of the times we'll see, and the reality is, and I think this is a part where that developmental framework is really important. So understanding development and where kids are. I mean, a lot of the times kids should have by 6 months, they should have that or 6 weeks, they should have that preferred caregiver. So they have somebody that they prefer, and that's okay, because that's building their ability to attach and to form relationships. Doesn't mean that they don't care for that other caregiver. And so we definitely explore that with each caregiver. And also, like I said, just helping with some of that anticipatory guidance on what their development looks like, what's coming next, what they can prepare for can be really helpful, because sometimes parents think they have to know it all. And at 6 weeks, parents can start to distinguish cries. Well, I went in, I think I shared this here before, but I went in one time to see a patient that just delivered, and literally it was like 2 days. And she's like, I don't know what the cry is. I don't know if either they're hungry or they need changed. And my mother-in-law's here and she knows exactly what they need. And I'm like, that's because your mother-in-law raised 5 kids and she probably has a good idea what they need at that point. But the reality is you're not going to distinguish the cries until like 6 months. And she's like, oh, so she took 6 weeks. I keep saying 6 months, 6 weeks. And she took this deep breath of like relief. And I was like, wow, like so much pressure she was putting on herself to know those cries. So.
That's crazy. That's awesome. Thank you. Anybody else?
Well, thank you all. Thank you for being attentive.
Absolutely. I just have one announcement and then we'll launch our poll since we do that once a month. So just give me one moment. Our